Good morning. I will see now demonstration of acute case taking in simple acute diseases. We are seeing the demonstration of acute case taking. Simple acute disease. Suppose a patient is suffering from acute sore throat. He is giving you the presenting complaints. He has a severe sore throat for past 12 hours. 12 घंटे से उसको sore throat हो रहा है. He has difficulty in swallowing. Now you are asking precise location कहाँ पे है. Now location is right side of the throat. The patient is telling right side of the throat, and it is extending to ear. It is extending to ear. Now you ask, how do you feel? That is the sensation. The patient says raw, burning, as if some splinters are stuck. Okay, splinters are stuck. Now you ask modalities. You ask how, when you feel worse, when you feel better. So aggravation is by swallowing saliva, eating food, drinking cold drinks, empty swallowing. So swallowing saliva or empty swallowing or chewing food or even drinking cold drinks is making the patient worse. These are the aggravations. No, I feel better by warm drinks. Instructions given in organon for case taking. You ask about associated symptoms. Mild fever also, but even fever, even heat, I feel thirstless and I feel fatigue, I feel tired, but I cannot rest in one place. I am getting restless also. Now you ask more precise questions, peculiar or strange symptoms. The patient says pain shoots to the ear. Pain is extending to the ear on swallowing. Whenever I swallow, pain shoots to the ear and right side is predominant. The patient is feeling right side is predominant. And again you observe, general observation, the patient is getting irritated and the patient is chilly patient. Now, if you take the key symptoms for analysis, in this case, which we call the repertorization process, you tend to take throat pain, burning, splinter like. This is the presenting complaint for which the patient has come. This is an acute case. You have to take this symptom into consideration. So throat pain, burning, splinter like. This has to be in your hierarchy. Now modalities: aggravation by cold drinks, amelioration by warm drinks. This is a specific modality, peculiar modality. Right sided is affected. The patient is confirmly telling right side is affected more. Concomitants: the patient is suffering from thirstless, and whenever he swallows, he is having pain in the ear. So the pain shoots to the ear. This is a concomitant. Now when you take these key symptoms for analysis, you are getting top 3 remedies: belladonna, Hepersulf and Lyco. If you see belladonna, there is throbbing, redness, high fever and thirstless. The patient is thirstless, patient is having from mild fever, but there is no throbbing here. If you see Lyco, it is right sided, the patient is right sided here. Aggravation 4 to 8 pm, no specific such, and burning, the patient has burning also. If you see pain, here sensation, splinter is stuck. Aggravation cold, here the patient is telling drinks, and empty swallowing saliva is also painful. This means the patient is extremely sensitive. So here in this condition, in this acute case, simple acute case of acute sore throat, the most likely simillimum is Hepersulf. We could get from the symptoms, from the remedy differentiation, we could get the best fit medicine or best similimum medicine is hep herself. So this is the process of taking an acute case and analyzing the symptoms. Acute sore throat, so we are taking the presenting complaints, we are completing the instructions given in the organon by location, sensation, modalities and concomitants, and more precise questions, more peculiar or strange symptom and general observation is also taken. So we are not leaving out anything, but the patient is telling so symptoms in a manner. We need to ask less questions because everything is in fresh memory of the patient, and patient has come to you to get the relief. So in acute case taking, we need not take the case for so long. Case taking has to be short. Case taking will be short because the patient is narrating the symptoms spontaneously. Thank you.